Watch out, Cupid, stack me with a sickness. Pull your little arrows out and let me live my life.
Welcome back to the PI show. Before the break we were talking about medical negligence and some court cases relating to medical negligence, and essentially cases about failure to diagnose. The next case we're coming to was decided in New South Wales in 2004.
Correct.
But it was about a 14-year-old girl who was prescribed inappropriate medication.
Correct, that's
so
right.
I think she had a back problem.
She had what was called as SLE, systemic lupus erythematosus. Quite a mouthful. However, she was being treated with steroids, that's the form of treatment for this type of disorder. It's a muscular type of disorder. Now, she was given a higher dosage
of steroids. Yeah.
So they'd actually used a different type of steroid, and that had the effect of giving her osteoporosis and causing some fractures, micro fractures in her spine.
So her back was injured more than it should have been.
Correct. Her back was fine before she'd had this high dose of
Isn't it fair
steroids.
to say that she may never have had osteoporosis? And
well, she
not
needed.
at that age.
She should never have suffered
14 years
osteoporosis
of age,
at that
I've never
age.
heard of anyone at that age with osteoporosis.
But however, steroids, they're quite a powerful sort of drug, and you can have numerous side effects.
But
this was quite an extraordinary side effect from
a dosage of steroids,
that's right.
which she said was inappropriate.
That's correct, and it was for a prolonged period of time, 7.5 months.
Okay, so she sued the doctor who prescribed the steroids.
Correct.
And what happened?
Well, causation was not established in this case, and the plaintiff lost.
What does that mean to the average person?
To the average person meant that they could not prove that the doctor...
The link?
The link for him to be prescribing that high dose caused the fractures. They could not link that. That was not his fault, I guess.
So, really what the court was looking at was...
What's caused the damage to her spine?
Yeah, or there was something else they could have used, a different drug.
An alternative drug.
That would have given her a better outcome and less prospects of, or less, reduced the risks.
So she lost in the New South Wales Supreme Court.
She lost it at first.
And then, surprise, surprise, she appealed.
She appealed and she was successful.
So the Court of Appeal then said that the judge had got it wrong, and they said something very peculiar.
Well, they did say that the defendant's breach of duty did not cause or materially contribute to the plaintiff's injury. However, they looked at it in a common sense point of view and said that she should be getting costs as well as compensation for the damage and the loss of chance.
Okay, but again, well, firstly, the court did say, and we endorse this, that the courts have got to exercise common sense, which is, again, not always the case, dare I say. So they've got to exercise common sense. No matter common sense, the extra steroids probably did cause some damage, although it's very hard to establish medically. So the court then said, well, look, she did suffer a loss of chance of getting a better outcome.
That's right.
And also with the spinal injury, she would have had a better outcome in terms of her initial disease. I mean, she could have been treated properly.
The dosage of
steroid
drug was
excessive.
pretty high.
Yeah,
it was
very
almost
excessive.
spoke for itself.
So what happened in that case is that the Court of Appeal said the judge in the first instance should then rehear the matter on the question of damages.
Correct.
And you'd assume that common sense might have operated between the parties and they might have resolved the matter out of court, as a lot of matters do. Yes. So that was, I think, another case. And the third case is the matter of Gett
and Tibet, which is a New South Wales Court of Appeal matter. this matter involved a 6-year-old female who had been presented to her GP with vomiting and headaches over quite a long period of time. Now, the GP referred her to the Children's Hospital in New South Wales, and she underwent some tests. She was under the care of a Dr. Mansour, who diagnosed her with a streptococcal infection and discharged her that day. So she went home. The very next day, her GP referred her back to the hospital for readmission. She came under the care of Dr. Gett because he was looking after looking after Dr. Mansour's patients. He wasn't available, and she still was suffering from vomiting and headaches.
But at the time, they were really concerned with meningitis and things like that, weren't
Well,
they?
that's one of the things that comes first to one's mind.
And what happened?
Well, she was kept in hospital under observation. They attempted to do a lumbar puncture, but she was quite upset, and they didn't do it at that point. Now, while she was in hospital, she also contracted chickenpox, and her brother had chickenpox as well. So I think that they probably put 2 and 2 together, thinking headaches, vomiting. They looked at the prodromal period of chickenpox.
Is that a symptom, vomiting of
Well,
chickenpox?
you can get vomiting with chickenpox, but there's also the meningitis aspect of it too that you need to be careful of. So she was discharged. In mid-January, she went back to her GP. He sent her to the hospital again, and they performed a lumbar puncture at this point, and then there was a little bit of a lay period, and then she eventually had a CT scan, which identified...
CAT scan of the brain?
Yep, CT brain scan, and she was found to have a medulloblastoma, which is a form of brain tumour.
Yep.
And so she sued in effect because they didn't do a CT
scan
earlier
on.
And
That's right, there was a delay period.
Yep.
And again, it might have detected a brain tumour, and they might have been able to to do something.
And she's finished up with significant brain damage.
Well, she had to have surgery as well as radiotherapy, chemotherapy.
And as you say, it's a fairly catastrophic injury to a young child. She sued the doctor. What happened in that case? It went to the...
Well, at first instance, she got up. She got up. The judge Stoddart found that there was negligence taken by Dr. Gett, in that he had breached his duty of care to have not performed the CT scan, brain scan, at the appropriate time. And
that might have caused the injury.
Correct, yes.
And the judge, I think, awarded...
about $610,000.
$610,000 for damages in that case. It seems a low figure to me, again, but again, they characterised it as a loss of chance or opportunity to intervene earlier.
That's right.
And might have saved some part of the damage that this child suffered. I think that's all we've got time for. We'll come back after the break to conclude that case and wrap up another case.
Sure.
Thanks for watching.